All right, so we are going to just finish up a little bit on our hypothermia and start talking about frostbite. So we went over to the generalized hypothermia when we're losing too much of our warmth to the outside world. And we did a little bit on our submersion hypothermia, but now we're going to talk about localized hypothermia, such as in with frostbite. So when we go through frostbite, there are stages very similar to what we could see with our burns. It starts with a frost nip, then we can have superficial frostbite, and then deep frostbite. And it's really looking at what layers of the skin are the ones that are being affected, right? So here in frostnip, what you're seeing is just the epidermis layers are affected. As we start moving down further and deeper into the skin, this is our superficial frostbite. You can see that it's getting into these dermal layers as well. And then deep frostbite is when you're going through a lot of the different layers. So you've got the epidermis, you've got the dermis, and then it's even getting down to where the blood vessels, tendons, nerves, everything like that could be frozen as well. So it's just showing you kind of the differences. We're going to take a look at just some pictures just to be able to take a look at it. So this is the beginning stage of frostbite, which is known as the frost nip. You can see just there's a little bit of discoloration. You can also see this white and waxy that you see right here. That's often what frost nip will begin as. So it just becomes kind of like white-ish, waxy-ish in nature. A little bit of discoloration can start to form. You're starting to see just a little bit of like some deformities along in the skin, not within like the toe itself, but just on the skin surface where there's little parts that are starting to rise just a little bit. So this is the example of what frostnip is. Here is another good example of it where you can see this white and waxiness here on the fingers. Now, as we progress a little bit more, here we've got frostbite, and this is actually a picture that was taken after 3 days of it being frostbitten. So instead of just white and waxy, you can actually see darker discoloration that's happening over a larger range of area. And also right here, we have blebs that are starting to form. Bleb, B-L-E-B-S. Blebs are just like fluid-filled blisters, so to say, but it's not brought on by friction. It's actually just brought on from that freezing tissue. So this would be an example of like a superficial to maybe deep, just because of the range that it is. The unfortunate part is you really never know how deep it is by looking at it from this process. It's more on the healing side of things. You can start to determine whether it was more superficial, whether it was more deep, depending on how the recovery looks. So here's another example. This one, blistered hands. These are huge blebs that are there. This was a Sherpa that was frostbitten. Sherpas are the ones that will go out and they'll guide people up long expeditions, such as like going to Everest. They're more acclimated to the weather. They know the paths and they can kind of guide people who are up there. They'll hire Sherpas to be able to do that, but at a great cost to a lot of them. Now, I can't tell if this is a ring or not. It looks like it to me, but what I want to bring up is that if you are dealing with rings on the fingers when it comes to frostbite, no matter whether there's blebs or not, one of the main things you want to make sure is that there's nothing constricting the frostbitten areas, which means that if they have a ring, you need to get the ring off, and you need to do that any means possible. So an ideal situation, you would do it before the blebs start to form, and you can actually take the ring off without having to deal with the blebs or any swollenness areas. If you are in a situation in which the ring, their blebs have already grown and there's too much swelling in those fingers, you might have to cut the ring off. The other thing you can try if you don't, and there's actually like specified tools that are called ring cutters that work really well to be able to take them off. The other way to do it is if you don't have a ring cutter and you're trying to figure out how you can do it, you can take Something like a string. Dental floss works really well for it. Start wrapping it around the finger in question to give it some compression. Try to get that ring slipped over just a little bit of that dental floss and start working the ring up as you pull that end that's closest to the finger. So in this case, it wouldn't necessarily work just because of how much swelling is going on. But if it was a lesser amount of swelling, we would wrap this all in dental floss, like just really tight and together, so that dental floss is wrapped a whole bunch of times between like here into the knuckle where it starts to, get thinner, and that the ring would be able to fit over a whole bunch of times. And you try to move that ring so that it's just on to the edge of the dental floss here, and start moving it this way. As you pull on the string that's wrapping here off of the um, towards the base of the finger, it will start to move the ring in this direction. It does not work all the time. It's just kind of an in between. If you don't have a ring cutter, or you want to try it without having to choose to cut the ring first, you can do it that way. Otherwise, you do need to consider cutting that ring off, because you're stopping circulation from getting to these areas, and it'll make it that much worse on the healing side of things. Here we have some more pictures of what you can see. So blood formation is starting to form, and they did some rapid rewarming in warm water until the fingers were starting to flush. So you can see that they're starting to turn a little bit red right here, right? And then the blood started to form after that. So sometimes the frozen can actually just keep it frozen as a brick, very similar to like if you were freezing meat in your freezer, right? And so you can do it that way. And then as you start to heal them or warm them, understand that it's going to go through a huge process of healing. And that's when we're going to really see what the damage was that was caused. So, and that's really the trick when we're talking about how to treat for frostbite. Really, you're protecting the skin surface. So you're making sure that it's protected, it's wrapped nicely in a dry, sterile dressing for whenever things start to leak or become worse. The question becomes, should you rewarm it or not? If you are going to have to use the appendage, say for instance, it's on toes, and you are going to have that person walk out in an extended situation when you're evacuating a person and they're able to walk out, you would want to leave those parts frozen, because the damage that can get done on the rewarming side might take them out from being able to walk. And yet that frozenness can actually add a layer of protection if you're needing to use that appendage. The other time that you would want to make sure to leave it frozen is if there's a chance of it refreezing again. So you have the different layers of the skin, and it could be anywhere from the frostnip to superficial to deep frostbite. Well, what happens is if we rewarm it, then the next time it freezes, if it hasn't healed all the way, instead of starting from right at the skin surface again, it starts freezing more quickly, starting off from where the last part was frozen, meaning it could already be going deeper and deeper into the skin. And it happens much more quickly than if you have something that is frozen and you keep it frozen. For it to penetrate deeper into the tissues, it actually takes a longer period of time. So if there's a chance of refreezing it, you don't want to thaw it first, and instead just let it stay frozen. Now the question comes, well, how do you thaw? How do you rewarm it? So keep in mind the last time that you went out into the snow and made like a snowball with your hands, and then went in and washed your hands to go and eat for lunch. Now, when you take your cold hands that probably don't even have frostbite or frostnip, but they're just cold from being around in the snow, and you run them under the warm water to wash your hands, think of that pain that is associated with it, because that change in temperature activates a whole bunch of our thermoreceptors. And it's such a quick change that it actually activates our nociceptors as well, which are our pain receptors. So that's why when you go from something that's really cold and frozen, or having contact with the ice, and then run it under any warmer water, it can be extremely painful. So you do want to thaw them gradually, with, starting with kind of tepid water, moving into slightly warmer, never anything above 104 degrees. You want to make sure like the hottest you get up to is like around 102 degrees or so. So think of it like cooler hot tub temperature or so. It is nice if you can have running water, just because in that case, it's not leaving it for the chance of the water cooling off by hitting your hands. If all you have is like buckets or something to be able to put the hands or the feet in, or the frozen appendages in, you want to make sure that the water is staying warm enough to continue thawing. And so you might have to replace some of that water as you go. Otherwise, the frozen parts that are being submerged into the water will actually cool the water off itself, and they'll start to lose heat through those processes as well. So something to keep in mind for that way. Here's just another picture of a foot. We've got a lot of bleb and blister formations. This is happening 24 hours after the frostbite originally occurred. So it's just to keep in mind, like it's just showing our healing process as we go. This is now 6 weeks after the frostbite injury that was shown in this picture right here. So as I'm saying, it's really hard for you to be able to know what the damage is that's being done until you start the healing process. So now we're looking at issues like this was a full thickness, or a deep, deep frostbite that we have here, went into the muscles, into the bones, into the tendons, into the nerves, and everything like that. And we only know that as it starts to heal. You can't predict that in the future. These areas were more, of a superficial frostbite in which there's damage that's being done, but it's still on the skin level instead of getting down into actual more heavier structures of the appendages. I do have a little frostbite case study that I wanted to talk to you about. So there's a 26-year-old athletic woman who became hypothermic in Crawford Notch in mid-February 2000. She had gotten lost. She fell in a river beneath deep snow, and she was able to change all of her clothes, except she didn't have an extra pair of shoes. So she did not have shoes to be able to change, so she kept her wet shoes on, because she was trying to hike out. It was causing her a lot of pain because frostbite was setting in. So she took some Advil and she walked out after about 36 hours. And the person that she was with had not fallen into the river and was not affected by frostbite at all. When they got out, they took her to the nearest hospital right away, and her feet were rapidly warmed in 40-degree Celsius water. So it's right around that 104 degree or so, maybe 103 degrees. She was hydrated. She was given Toradol, which is a painkiller, and Silvadene, which is an antibiotic, and that was applied to the toes itself. They kept the toes warm all night on warmed IV bags. That's another way they try to maintain the warmth of things. The toes looked very similar the next morning. She flew home to Washington, D.C. that afternoon. Now, I'm going to show you some pictures of the healing process as she kind of went after certain time periods. She did see a lot of surgeons who cared for her feet with bathing them, keeping them clean, doing antibiotics to the skin, and she needed a lot of good pain management just because of the pain that was associated with it. Remember, this happened back in February of 2000. So in April, she had what's called debridement done. Debridement is when you cut away dead tissue. So the necrosis, or that dead tissue that's starting to form on the feet, she actually had them that cut away and had a few amputations is what you'll see, and has had multiple revisions on surgery since then just to try and fix everything. After physical therapy and swimming, she can now run, but she does blister easily on her feet. She does wear orthotics to be able to help her, and has been working full time with a lot of her non-athletic pastimes resumed. Going out and doing athletics is a little bit harder for her, and she does experience some phantom pain. Phantom pain is when that appendage has been removed, but you can still feel the pain messages that are traveling or that are activated within the brain as if they still had that toe attached to them. So this was a picture of her feet 2 days after this frostbite. And when you look at it, it looks bad, right? But as I said, you don't know how bad it's going to be until it starts healing, right? So this is just a little more closer up of the pictures. I mean, if you had to sit here and predict like what's going to get removed, I'd love for you to take a guess right now, just based off of what you're looking at, like what gets removed and what doesn't get removed. Everything right here is localized to the tips. Like here's the tip of her toe. This one goes down to like the base of her toe, but none of it's going into the foot on either side. Here on the bottom, it looks like there might be a little bit more damage that was done, but on the it's actually the posterior side of the foot. This is what we're looking at right here. The posterior or the dorsal side of the foot, things are all stopping right here at the toe level. It looks like maybe it's going into the foot on that anterior or that plantar side of the foot. So yeah, you can see a better picture of it here. One of her feet, you do see it coming down into this region of like the ball of the foot, but not so much on her other foot that you can see. So this is all within 2 days. After 2 months, this is what her feet were looking like. So you can kind of see, I'm going to just jump back for a moment and just kind of like look at some of these pictures. So here, what you can see like on that dorsal side of the foot, and if we compare that now to over here, right? So there was actually some sections of her big toe that were still pretty good and intact, but like this toe's not looking so good. This big toe's not looking so good, right? So that's 2 months, a little bit closer of a view of it. It's just kind of showing. It looks like the most of the damage was done right here on this one, and then this toe and a lot of this one. This is looking like maybe we could recover some of that. This is now looking at the bottom of the foot. And remember on this one, we did have a bunch of discoloration coming down into the ball of the foot, but that looks like it was more superficial because you can see it's got like new skin that's underneath it, but at least it's not necrotic at all. It's not necrotic and that we're missing it. Looks like we still have some flaking off that's happening on this foot. So just to kind of keep that in mind. Well, then she went into surgery, and this is now 3 weeks after surgery, where she had the debridement done. So we did end up, they removed this toe entirely. And then it looks like they probably cut away some of the tissue here, but it wasn't actual like amputation of anything like that. We did amputate these two right here on this side, and then a lot of the tissue that's around. So this is just kind of giving you a picture of that healing process as we move from right after frostbite all the way through 3 weeks after surgery, which is about 3 months after frostbite had set in. Now, just looking at like how quickly does frostbite tend to set in? Well, there's different ranges, and it kind of depends on like what's going on with air temperature and what's happening with wind speed. So this just kind of gives you a clue. So here, coming down on our y-axis, this is our wind speed that's happening in miles per hour. And then air temperature is going across on our x-axis here. So the more you drop in air temperature and the more wind speed that you have, the less time that it is before frostbite will set in. If we're at 0 degrees Fahrenheit and there's not much wind, it can take a long time for that to set in. However, if we're going to extreme temperatures where it's really windy, it can only take like 2 minutes before frostbite setting in. So it really just depends on what the temperature is and what that wind speed is on how quickly that it sets in. Now remember, for treatment, what we're going to do is decide whether we need to thaw it or not based on what is going to be happening afterwards. So if it's like they need to hike out with that appendage and they need to use it, or if there's a chance that it might get frozen, we want to make sure instead just to keep it frozen and not to thaw it in the beginning. If we are going to thaw it, then we're going to make sure that we're monitoring it, that it will not refreeze, slowly warming it up in warmer to warmer to warmer to hotter water until it is completely thawed. And at that point, you need to protect it greatly with wrapping it with sterile dressings and just making sure we're keeping the integrity of the skin as much as we can from getting dirty or having bacteria set up. We don't want gangrene to set in or anything like that. The last thing I want to show you with hypothermia, it's kind of considered like a type of hypothermia. This is not the same feat that we were just looking at. This is actually an example of somebody who is suffering from immersion foot. So immersion foot is also known as trench foot, and really it just describes somebody who has been, so for instance, it was first kind of noticed in the wars, in which there would be, in order to avoid being seen by the enemies, the enemy soldiers, what you would do is you would walk along in trenches to kind of lower your heads down a little bit more and not have to like bend over the entire time, but you would walk along in trenches, and those trenches often had water filled within them, just cold, regular, ambient temperature water, not frozen, just cool to the touch water. But what would happen is they would walk all day in this water, and the feet would remain cold and wet all throughout that time period. And our skin is not really made to stay wet and cold in these type of environments, right? It would fill up with the boots. There would be water all in the boots, and then it would just kind of sit there and not have a change of boots, not have change of socks, and immersion foot, or what's also known as trench foot, would start to set in. So this is kind of what it starts out looking like. Again, a lot of damage can actually come from it, right? So it can start looking like frostbite, even though it's not freezing. It's more just bacteria is setting in, and it's causing a lot of necrosis of the skin because of that. So it's still not a good issue to have. As far as treatment goes, you don't have to rewarm it. Really, it's just about drying it off. But you do need to be ready for the pain that's associated with it. And you also need to be able to deal with keeping all of the area clean so that more bacteria doesn't set in and we don't have infection setting in. So the best thing to do is to prevent it. And the best way to provide prevention for immersion foot or trench foot is to make sure that your feet can have at least 8 hours of dry time a day. So what does that mean? So what that means is that if you are out hiking or doing water activities or whatever the case is, and your feet and your socks get wet, leave those wet and socks and shoes on. When you go to bed at night, put a dry pair of socks on and let the air, or let the warmth of you sleeping and the dryness of the socks dry out your feet for while you're sleeping. The next day, when you get up to hike again, don't leave your dry socks on if you only have 2 pairs. Instead, put the wet socks back in, keep the dry socks dry, and hike for the rest of the day in the wet socks. And again, at the end of the night, switch back into the dry socks. Now, in an ideal world, you would be able to dry out the socks as you're hiking, right? So the sun would be beating. You could actually hang the socks on the back of the backpack and let the sun dry them out. But if you're in constant rainy weather, your feet are going to just continue to get wet over and over and over again, keep a pair of dry socks at all times so that you can always have that option of keeping them dry. You can also put socks in warmer areas of your body, like around in your waistband or under by your armpits. And sometimes the heat itself can start to dry out those socks. Even if it's raining, if you like are under the rain gear, just make sure that they are dry. Your feet are dry for at least 8 hours every time that you are stopping, like every day that you're going, to avoid immersion foot from setting in. So this is just a couple more examples of what you can see. This was actually done in warm water. So it's really just the water. If you're soaking your feet for long periods of time, you can still do it. But you can see I'm going back to this other one. This was done in cold water. You see a little bit more resemblance that was done to as what you saw in Frostbite. In warm water, it still does set in. It just doesn't quite look the same. This one was confined just to the soles of the foot that you can see right here in the warm water. So that's what I have for you as far as finishing up cold injuries and emergencies. And so if you have any questions, make sure to ask during class.